Public health encompasses so many different aspects, from sociology to anthropology to any ology you can think of, really.
We tend to think that biomedical factors are the most influential drivers of health outcomes, but the non-biomedical factors, where you live, what kind of nutrition you're getting, racism, sexism, these are just as consequential, sometimes even more consequential.
The air that we breathe, the water that we drink, and the food that we eat, making sure that those are as clean, as healthy as possible.
Guns are not a public health issue, gun violence is. Cigarettes, smallpox, road safety.
The obesity crisis and everything that brought me to public health.
When you see a 13-year-old who comes in and she's experienced some kind of sexual violence, it's about doing more than just treating her in that moment. So public health to me is about justice.
I came here because people here want to tackle the big problems. And I said, you know, I've done a lot of controversial research. You should know about this before you hire me. And the reception I got was not what I expected. It was really great. That's exactly why we want to hire you.
I like to look at the epidemic through the eyes of the bug and look for clues on what the bug is doing as it spreads through populations.
Mailman has an enormous breadth of talent, and Columbia larger still. We have the ability to reach out to centers all over the world where we already have infrastructure that's in place.
There are hundreds of millions of people who don't have access to clean, safe water, billions of people who don't have access to clean, safe, reliable sanitation systems.
Although we start from a global context, what it then trickles down to are the individuals who are living in that community, in that city, in that town, and how that's going to enable that individual person's life to be better.
We care a lot about what's happening in New York because it's our city, these are our communities, we are part of that community, so we want to make sure that our community is as healthy as possible.
If you're in New York City and you're interested in public health, you basically have a front row seat to the cutting edge of what is being tried in the public health and social policy fields. So that's one really exciting thing.
I'm so grateful to have had the chance to go to Mailman to do my master's in public health. I very much feel like it closed gaps that I was aware of and filled gaps I wasn't even aware of.
It's for people who are big thinkers, who don't think that they have all the answers to a particular question.
What I love the most about the school is the energy, enthusiasm, engagement. You can feel it.
The fact that I could sit and rub elbows with a biostatistician, an epidemiologist, a social scientist, someone who's thinking about sexual health, is something that drew me to say, this is where I want to be.
We are all driven by the same goal.
We're much more about big picture fixing than we are just treating an individual.
It really is about building a healthy and just world.
One of the real privileges of public health is that you get to actually act on your passion. People are here because they care deeply about social justice and bringing science to the public good.